A central Indiana plant is now making changes tonight after finding itself at the center of a COVID-19 outbreak. The Tyson plant in Logansport, Indiana, is now linked to hundreds of cases across central Indiana. But Tyson is not shutting it down like the pork plant in Iowa. Instead, as our Rich Van Wyk shows us tonight, it's taking new precautions to keep everyone safe.
County officials call this Tyson meat packing and processing plant the epicenter of a COVID-19 outbreak that has sickened hundreds of people. 211 confirmed cases so far in Cass and its surrounding counties. 2 of the victims, children. They died. Health officials say the vast majority of the victims are employed or in some way connected to the Logansport facility. Union leaders are worried.
We're always concerned about all of our members' health and safety, especially now.
Spokeswoman Bridget Kelly says the union and the company have been working together since March to protect workers from the virus. Monday, Tyson suspended operations for deep cleaning and sanitizing. Infrared scanners take workers' temperatures. Personal protection gear is mandatory. Duct tape break room tables and plastic dividers put more space between workers. The company said it relaxed attendance policies so sick workers stay home.
Is the company doing enough as far as the union's concerned?
There's always room to do more. And so we're continuing to push for additional measures to make sure that our members are as safe as possible at work.
In a statement released late today, Tyson officials said, Tyson workplace safety efforts are significant and strictly enforced, said Tyson Vice President Jim Schmitz in a prepared statement. We understand everyone, including our team members, is anxious during this challenging time. According to local officials, many Tyson employees work together, commute together, and live together, making it even more difficult to slow the spread of COVID-19.
To Kokomo now, where COVID-19 frontline workers are now preparing for a visit from the Vice President. GM workers just learned today that Vice President Mike Pence is expected to visit the Kokomo plant. That visit set for next Thursday, April 30th. Now, this is the very facility where production shifted to making ventilators, and the very first of those ventilators recently arrived in Chicago. It's projected by the end of August, those 1,000 workers in Kokomo will produce a total of 30,000 ventilators. And now to the headlines that come from state leaders today during their daily COVID-19 briefing. We learned that there are now another 31 families that are grieving the death of a loved one. These deaths, however, we want you to know, are not overnight. They do represent a timeline of April 2nd to April 21st. Nearly 400 new cases of the virus now officially identified in the state of Indiana. That number happens to be lower than expected because of a reported technology issue. The health commissioner also addressing today test availability.
So from the standpoint of having labs and systems that are ready and willing to do the testing, we have that. Now the question is, do all the places that are open and available to test for individuals, are they accessible? Do we have them all over the state? And do they have the swabs and the viral transport media that they need to do that testing? So we have the ability to run the test. We need to now make sure we've got the ability to take the test.
We learned the grant money is going to 13 rural communities in the state of Indiana that include Logansport and Cass County. That is where the Tyson plant is located. Also today from the governor, no official word about when he's going to reopen the state. Previously, as you recall, he did indicate that he wanted to open around the beginning of May. But some scientists say when they look at the data from Indiana, that date may be too soon. There's a new model from the Institute for Health Metrics and Evaluation. This is from the University of Washington. The data from Indiana shows that we might want to hold off opening the state until May 18th at the earliest. It also did look at other states that are planning to reopen soon. For example, Georgia. According to these researchers, they should wait until June 8th or later until that state reopens. And now in Washington, D.C., that's where lawmakers are working on a relief package. The House now expected to send a coronavirus relief bill to the President Trump's desk by tomorrow. The Senate yesterday passed the package. It contains nearly $500 billion in aid. That money mainly is for small businesses, but it also does include money for hospitals. There also is some money in that for testing. Also, a Minnesota representative also has introduced a bill to cancel rent and home mortgage payments. The Rent and Mortgage Cancellation Act is planned to forgive payments for a full year regardless of what your income is. It also would then set up a relief fund for landlords and also for those that hold your mortgage. And it appears that most Americans say, you know what, they would like another round of stimulus checks. 84% of you, in fact, to be exact, according to a new study that's out today from WalletHub, it found that nearly 160 million Americans are less than 3 months away from running out of money. And we know that you're waiting for that check, and still of you have not gotten it. If you have questions about how much you're going to get, we've made it easy for you. What you have to do is text the word stimulus to this number, 317-655-5740. We'll help you calculate the check. Be sure to text the number. Don't call it. We'll get the fax then sent straight to your phone, and we'll do that calculation as soon as possible. Also, the city of Indianapolis is trying new ways to curb the spread of COVID-19 among the homeless. One way is placing 15 hand washing stations in the downtown area. 2 of them will be at Monument Circle. The stations are equipped with soap, water, and paper towels. The city is also adding portable restrooms downtown since most of the public restrooms are now closed. Also, some students at IUPUI have started a petition because they would like a refund from the university for their parking permits. They told our Ellen Carter today they shouldn't have to pay for what they can't use.
The parking spots are empty on the IUPUI campus, but students are still paying for them.
For them to essentially say, well, we're not giving refunds for something you paid for.
Ryan Ward spent $384 for a year-long parking permit, but with the coronavirus shifting classes online, it's been 6 weeks since he's been back to campus. Despite not being able to return, the school says they're not giving refunds.
Understandably, I know I'm not going to get, and everybody's not going to get the full amount of refund because we use it for 2 months. But the remaining for the 3 months, I think, is like $105, which isn't a lot of money, but students could use it, especially now. Some aren't working.
I was last on campus March 12th.
Macy Hardwick was so frustrated, she started an online petition, and in just a matter of days has garnered more than 2,400 signatures.
I feel like the right thing to do is that we should get like a prorated refund, like a partial, for the time that we are not able to use our parking passes.
And the administration says that their permit refund policy is consistent across all IU campuses, that deadline is January 31st. They also say that they need those fees to maintain parking infrastructure. In a tweet, the university said their decision will allow them to keep operations consistent once things are back to normal. But these students feel like they shouldn't have to pay for something they can't control and certainly can't use.
Happening today, our healthcare heroes finding a way to thank first responders. Look at this video. Riley Children's Health dropping off a little red wagon full of snacks for Metro police officers over in the East District.
There are so many more people than just the frontline workers at the hospitals that are putting in work to support our communities and keep us healthy and safe. We were able to visit our IU Health supply chain this morning and thank some of them and thank the drivers that are delivering the critical supplies for us. And, you know, our police officers and our firefighters are always putting themselves out on the front lines, but right now it's a little scarier, you know, going into unknown situations.
Well, that token of appreciation certainly meant a lot to those officers today. You remember the East District suffered the loss of Officer Bree Leith about 2 weeks ago.